What is an early childhood program? What is an IFSP? These are two common questions from parents. According to the Department of Health and Human Services Maternal and Child website, early childhood programs support the vision of a comprehensive, high-quality early childhood system that promotes maternal, infant, and early childhood health, safety, and development. This program is meant to effect change that will improve the health and well-being of young children and their families. An example of an early childhood program is the newest program that came from the Affordable Care Act, Maternal, Infant, and Early Childhood Home Visiting Program, for short, MIECHV. The goal of MIECHV is to improve the health and developmental outcomes for at-risk children. A more well-known early childhood program is Head Start. According to Nebraska law, a child who is 6 prior to January 1st of the current school year must be in kindergarten or above. Therefore, the student or child is no longer eligible to attend an early childhood program. To be eligible, the child must be birth to age 5. An IFSP, which stands for Individual Family Service Plan, is a plan set in place to provide services to a young child with developmental delays or disability needs. The services outlined in the IFSP are to be primarily carried out in the home because this is the child's natural environment. As a child enters new settings, such as preschool, these can also be included because those are going to be the new settings that are becoming their natural environment. By law, according to the IDEA, Part C, the child's family is to be assigned a services coordinator. The services coordinator is there for the family to help with a wide array of things. Prepare yourself, this is a very long list. Help access the necessary treatment and support from qualified providers, appropriate referrals, scheduling appointments for assessments and services, coordinating early intervention, evaluations, and assessments, involved in all steps of the IFSP, identifying available providers through referrals and other activities, coordinating, facilitating, and monitoring the delivery of services, follow-up activities, advising families of their rights and procedural safeguards, coordinating funding sources for required services. And last but not least, facilitating the development of transitional plans. The IFSP in Nebraska has a website that is geared especially toward families that are researching and have questions. www.ifspweb.org. Not only does this website encompass a wide array of materials, but they also give parents the tools to get them prepared for how an IFSP is developed. An IFSP includes how the family and service providers will work together to help the child develop. The IFSP does not only focus on the child, but also how the family can be supported through determining how to help the child. The ParentCenteredHub.org also has great information and easy-to-follow explanations of an IFSP. There are 10 things that must be included in each IFSP. The child's present level of functioning and need in the areas of his or her physical, cognitive, communication, social, emotional, and adaptive development. Number 2, family information with parental agreement, including the resources, priorities, and concerns as a parent, and maybe if you have any other family members who are closely involved with the child. The major results or outcomes expected to be achieved for the child and the family, the specific early intervention services the child will be receiving. Number 5, where in the natural environment the services will be provided. It is very important that if the services won't be provided in the natural environment, such as at home, that the IFSP must include a statement justifying why this is happening, and that's just better for long term. Number 6, when and where the child will receive the services. Number 7, the number of days or sessions he or she will receive each service and how long each session will last. Number 8, who will pay for the services. The name of the service coordinator overseeing the implementation of the IFSP. Number 10, the steps to be taken to support child's transition out of early intervention and into another program when that time comes. Now we have to let that absorb for a little bit. The IFSP is developed by the parent or the parents of the child, other family members if that is requested by a parent, and it is also if it is feasible to have them there. Another advocate or a person outside of the family if the parent requests that the person participate. The service coordinator is designated by the system to be responsible for implementing the IFSP. A person or people directly involved in conducting the evaluations and assessments of the child and family. And lastly, the person who will be providing early intervention services under this part to the child or the family. Now, lastly, the state of Nebraska has some primary provider services that I have personally worked with. One of the most common services that I have been a part of is respite care. Respite care is defined as a temporary caretaker comes into the home and takes care of an individual with special needs to give the primary caregiver a temporary break. The respite care I have worked with a younger boy who is below the age of 10 who has autism, and we have a specific plan set up through a provider who actually has a plan set out for him with different playing and things like that. And my actual service that I do for respite care is that I take him swimming, and that's his fun playtime. And that also gives his mom a break. And so she has plenty of time to kind of have her me time because she spends a lot of time just being the caretaker 24/7. And another respite care that I work with is with somebody who is actually in their upper teens and is in college. And so I get to help him transition a little bit out of the home and make sure that he gets that time alone that he needs and make sure that his parents kind of have their own time too. I think it's really important just for respite care because that's time that maybe other parents don't think about, that they get some rest time when their child's at home. They can have their own playtime. They don't need all this caretaking. They don't need to help go into the bathroom, things like that. It's really important for families with children especially. They have a lot of work anyways, and if you add disabilities or developmental delays on top of that, those needs get really, really high, and those caregivers definitely need a little bit of a temporary break just from a little bit of responsibility. So